Thank you. To ask the Minister for Health and Social Care what collaborative strategies are in place and planned between mental health and public health in order to improve the mental health of the general population of the island.
Absence of the Minister, I call on the member for the department, Honourable Member for Douglas Central, Mrs Corlett.
Mr President, the Mental Health Service and the Public Health Directorate collaborate effectively in order to improve the mental health and well-being of the population. They collaborated with other key stakeholders on the development of the Strategic Plan for Mental Health and Wellbeing 2015 to 2020. This is the first broadly owned mental health and wellbeing plan for the Isle of Man. The plan advocates a holistic approach to mental health and wellbeing and also sets out a vision of collective responsibility for mental health in the Isle of Man. This plan is committed to the development of a mental health mode of provision. This will follow a life course approach from childhood through to old age. The Mental Health Service and Public Health Directorate collaborated on assessing the levels of mental ill health and well-being in the local population, notably in the development of the mental health and well-being questions in the Health and Lifestyle Survey published in October 2017. The Mental Health Service and Public Health Directorate are also collaborating on the health improvement within the Public Health Implementation Plan, with a range of actions including the Manx E-Clinic, which is a rapid access to low-intensity mental health interventions, the self-harm strategy and a strategic review of the public mental health.
Mr Speaker, supplementary.
Certainly, Mr President, we heard earlier about the effects of social media and how that affects mental health of people of all ages, and in light of the increased referrals to mental health services, whether the member considers that mental health issues are starting to become an epidemic on this island, and what further can be done to remove the stigma and improve the resilience of the population as a whole.
Mrs Corlett to reply.
Thank you, Mr President. I would totally agree. But what I would say is that it's not only collaboration between mental health and public health, or even all divisions within the Department of Health and Social Care. All government departments must work together if we're going to make a difference. Yeah. Education, lifelong learning, sport and exercise, housing, employment, crime, courts. I could go on. Mental health concerns us all. But it doesn't stop with government. Working with the private sector and the third sector is imperative if we are to break the silence that surrounds mental health.
Supplementary. Chief Minister.
Thank you, Mr President. Would the honourable member agree with me that the island introducing in 2015 the first ever mental health strategy for the Isle of Man, a new state-of-the-art mental health facility at Manannan Court with extra capacity to enable us to treat more people on the Isle of Man, an early intervention wraparound family team to help those families experiencing their children with mental health issues instead of having to send them off the island, has been a major advancement in helping people with mental health issues on the Isle of Man. But I'm sure the honourable member would also agree with me that we should always look to improve the service on mental health that impacts 1 in 3 of the population.
Mrs Corlett to reply.
Thank you. I can't help but agree with all the Chief Minister said. What more is there to say? I would just say that, yes, we have to push on, and are things moving fast enough? In government, they never do, but I can assure the Chief Minister that I take every opportunity to push mental health up the agenda.
Supplementary, Mr Speaker.
In light of the Honourable Member's comments, does she have a timetable for some of the collaborative actions that she mentioned in her initial answer, and is there anything she can do to try and move them on a little bit more rapidly?
Honourable Member to reply.
We have some timescales in the Mental Health Directorate Business Plan 2017, Public Health Directorate, I should say, Business Plan 2017 to 2020. The Manx E-Clinic is due to be completed in March 2018. we're having a strategic review of mental health in March 2019. A proposed paper for improving health within the department is due in October well, we've passed that, so perhaps not. That's about all I can say. I can circulate any further information.